Hi, I'm Steve Adebato. As you can see, we're here at the opening of the Matthew J. Morahan Memorial Health Assessment Center for Athletes here at St. Barnabas. Listen, I'm talking to you after the event. It was a powerful event. We heard from 4 professionals here at the center who are making a huge difference. The center's only been around a short period of time, but they've assessed athletes. They've made a difference with young athletes. It is a groundbreaking, trailblazing center that's going to really set the mark very high to protect young high school athletes and even younger. So what you're about to see is a series of clips from some people we spoke to, some of the presentations tonight, and also Orrin, who is Matthew's sister representing the Morahan family. It is a powerful video, and we hope you appreciate it. Thank you. Michael, let me ask you, you're a physical therapist, the Matthew J. Morahan Memorial Health Assessment Center for Athletes here at St. Barnabas. From your perspective, how important is it going to be?
Very important. In physical therapy, in the rehabilitative world, there is a tremendous amount of science that shows that we can find kids who are at risk, and this is our opportunity to use it.
Okay. If it were not for such an important development like this, what would happen to these young athletes?
We would continue to see the very high and rising risk of musculoskeletal injury in athletes, which has profound effects on the athlete and their family and society.
A center like this long overdue, isn't it?
Absolutely.
Let me ask you something. Finally, what would you say to all the parents out there, those of us who have kids who play sports and we worry about them all the time, the significance of this center, particularly for us as parents who are worried?
Hope. That there is hope. There is a lot that we can do to make our kids safer.
Dr. Putnam, let me ask you this. You've been dealing with kids for a long time, all sorts of very difficult, sensitive, challenging medical issues. A center like this, how important is it?
It is imperative. Cardiac screening is absolutely imperative at this point. We've had, just within a one-year period between 2000 and 2006, 3 16-year-old kids die within a 10-mile radius of this place. These kids could have been identified by just a simple EKG or a cardiac screening. It doesn't need to happen. We're starting. This is the first step, and I'm hoping and I'm very hopeful this is going to work out.
John, let me ask you this. A center like this, it's long overdue. St. Barnabas has taken the lead. What will it mean to children, young people who play sports, but also their parents, those of us who worry so much and talk to doctors like you so often about our fears?
You know, I being a parent of an athlete myself, every time my kid goes out on the field, I know there's dangers to it. I want them to be able to do it, but there's certain cardiac problems, which is my area of expertise. My kids have been looked at. They've had their EKGs. I know that their hearts are fine. That isn't the standard out there. And in our country right now, a surface electrocardiogram, which can rule out a large number of the more serious forms of cardiac problems, is not recommended. I think it's wrong. Our European colleagues, the Italians, have been doing it for 30 years.
We're catching up.
Yeah, we're catching up. We'll get there. You know, this is a first step. We'll hopefully continue to move forward from here.
What is the significance of the center opening tonight officially?
Well, I think this is an important center to open in our times because with healthcare the way it is, everything is looking at treatment. We're looking at prevention. We're looking at identifying cardiac risk, concussion risk, injury risk, and treating those individuals, those athletes, and helping them before true injury can occur or anything more devastating can occur.
What's been the reaction so far, particularly the concussion part, also dealing with cardiac issues? I know things are just getting started, but the numbers are pretty impressive so far.
The numbers are outstanding. Our last cardiac screening, we identified 15 athletes at risk out of 149 athletes that were tested.
What does that tell you?
That tells us there's a lot out there that a lot of athletes are at risk and they don't know it.
This center is critically important, isn't it?
Very important. This is time for something like this to be in our area and really throughout the country.
A center like this, and a night like this, what does it mean?
Well, it's very special to me in a dual capacity. One, being the CEO of the St. Barnabas healthcare system, where I think we are offering a program that will genuinely save the lives and alter the lives of not only athletes but families throughout the state of New Jersey and throughout the region. And as an uncle, this program is named after my nephew who had an untimely death at 29 years of age. But the family has rallied around to to help perpetuate his name by creating a program like this that will prevent other families to have to deal with what our family has dealt with on such an untimely death. The thing that's so exciting about this program is that these deaths can be avoided and will be avoided with the expertise that we can offer both on the brain trauma and the cardiac trauma, and we're very excited about it.
Assemblywoman, this has been a cause for both of you. Why does it need state legislation for us to do the right thing, and what's going to happen because of it?
That's a good question. Unfortunately, it does require legislation, and I think there's been a growing awareness throughout the country, and especially here in New Jersey, for the need for this kind of facility and this kind of assessment.
Assemblyman Giblin, you've been involved and interested in sports and kids for a long time. What does it say to all the parents out there that a center like this is being established at St. Barnabas?
Well, I think it demonstrates a concern by the St. Barnabas Medical Corporation that they are interested in the welfare of our athletes. This issue of brain concussions is very severe. You need to measure first impact and kind of study it. It's been shown even with our professional athletes that it does have long-lasting repercussions. So we're trying to intervene here early, and I applaud Ron Del Moore and all the leadership here.
Is tonight what you expected in terms of the information that would come out?
Very much so. Actually, it was more than I expected. I thought it was very, very well presented. I think the speakers did a great job in informing us of what's available, and I would like to make sure that I can bring this back. I'm a school nurse, and I would like to bring this information back to my school and let athletes and students know that this is available for them. I think it's wonderful.
We have just concluded a very powerful program here at the Matthew Morahan Center. Dr. Devinsky, you're part of that program. What's your takeaway tonight?
I think it's about prevention. I think it's about the safety of our kids, and I think it's bringing the message that athletes, we have a responsibility to them. We send them out on the fields, and we have to do everything we can to prevent injuries, and if they are injured, to make sure they get the best treatment possible.
Listen, I mean, you saw tremendous enthusiasm tonight. You see a lot of people with a lot of questions. This is reflective of what out there in the community in terms of people really looking for a source, a resource.
I think in the past, people just assumed if your child had a concussion playing football, if there was an injury, they just recover, go back at it. But I think we understand now that these injuries can be cumulative. They hurt kids. They affect their ability to play sports as an adult. And we just have to recognize it's a national epidemic, these injuries. And we as a country, we as a state, we as a community haven't dealt with it. And I think we can start at a community level and build up from there.
We spoke to you before the program. Is this what you expected tonight? Because it was very powerful, and I see the reaction that a lot of the parents have here tonight.
Yeah, the information is compelling. So I was hoping that with the enthusiasm that we have as people, coupled with that information, really create a stir, and it looks like it has.
We've just completed this program, and you're a parent. You're worried like the rest of us. What's the biggest takeaway that you'll bring with you tonight?
I think it's very enlightening to see how the doctors work with the children and how everything is all put together and how important it is for the community at large that they're doing this for our kids. And this is very special, especially with all the athletics that are in the surrounding area. It's very, very important that our kids are going to be treated and looked after, and we know that they're going to be safe.
You were just talking about your son plays baseball, right?
Baseball.
And you want to get him up here. Say you get him up here, and why would that be so important to you and for him, more importantly?
Just so I have peace of mind because he's playing baseball. He did wrestle. Now he wants to do jiu-jitsu. So he's doing all this crazy stuff. But just so I know that when he does do this, that, he has that, had this taken care of. They have the baseline. So God forbid if something does happen to him, that I know that, we could always come back here and that we know where.
Peace of mind is pretty powerful.
Definitely. That's the biggest thing. As long as I have peace of mind, I know that he's okay.
Something really powerful has come from, obviously, a tragic situation. Is this the kind of night you expected for such a powerful thing to happen?
It is. As I mentioned during my words before, I came here to the first clinic back in September, and I met these two little boys, and they were brothers. They were probably about 8 and 10. And they came up and they looked very confused whether they were going to speak with me and my 19-month-old. And they were very confused. And I said to them, what sports do you play? And all of a sudden they looked up at me with these shining eyes and these huge smiles and recited just about every sport under the sun.
Every sport.
Every sport. And it was as though Matthew was smiling up at me, and it was a really just meaningful moment. And tonight was really everything that I could have wished for it to be. I hope and I pray and I think that what got across tonight in our family's dedication to this is just what a special guy Matty was. And we just, pray that so many families can benefit from this and that no one has to go through what we have. And we feel so blessed that through Uncle Ron and all of St. Barnabas, we can turn our loss into something really good.
Can't imagine, no one can imagine what you're feeling, but that's got to give you a little bit of sense of, hey, this is a really good center. It's going to make a powerful difference.
Absolutely. I mean, we're fortunate. We had Matty for almost 30 years, so we're looking forward to life beyond this, and we have a lot of faith, and we believe that this program that we're initiating today is going to be wonderful for New Jersey and a great testament to our son. So, thank you.
Thank you, Matt.
Okay.